Thank you, Mr. Chairman. I have a statement and a request to make. I hope I'll still have time for some questions. But we've had a lot of good news about the Affordable Care Act in recent weeks. 8 million enrolled in private coverage, 6.7 million enrolled in Medicaid, the number of uninsured dropping by 10 million people, and the rate of uninsured in states around the country dropping by 30, 40, even 50% in just 1 year. Actually, that's pretty amazing. And I want to put two articles in the record that discuss some of this good news and what I believe is the warped Republican reaction to it. The first is a column in the New York Times. The columnist writes, quote, "What you get whenever you suggest that things are going okay with the ACA is an outpouring not so much of disagreement as of fury. People get red in their face, angry, practically to the point of incoherence over the suggestion that it's not a disaster," unquote. He goes on to say, quote, "I suspect there's now an element of shame if this thing is actually working. Everyone who yelled about how it would be a disaster ends up looking fairly stupid," unquote. The next piece I want to highlight is from health reporter Sarah Cliff, who listed out, quote, 7 predicted Obamacare disasters that never happened, unquote. Here's the list. 1, the website will never work. 2, nobody wants to buy coverage. 3, the ACA would not meet enrollment goals. 4, only people who already had coverage are signing up. 5, there would be a net loss of insurance. 6, premiums will skyrocket. And finally, 7, that the law just won't work. People won't get doctor's visits, insurers will drop out, etc. And Mr. Chairman, each and every one of these predictions has proven flat wrong. 10 million people have gained coverage this year because of the ACA. Surveys indicate that they like their coverage. There are none of the increased wait times or skyrocketing premiums. Republicans claimed, especially when you factor in the financial assistance that is that's available. More and more insurers are participating in the marketplaces next year, increasing choice and competition. So, Mr. Chairman, I would like to put these two articles in the record.
Without objection, so ordered.
Thank you. You know, and I just want to say about this hearing, if this were a good faith effort to really find and fix some of the problems that are in the Affordable Care Act, I'd be more than happy to fully participate in every way in those kinds of efforts. Anybody knows that such a ambitious piece of legislation is going to have to be tweaked. I don't think anybody would disagree that there aren't ways that we could make this better. But time after time in this committee, what we do is look for ways to simply attack the law, suggesting that it is just horrendous, it's unworkable, when we know that it is helping millions and millions of people. 74% of Republicans who have signed up said they like that. You know, I would say that's pretty good. I mean, you know, there's still, you know, a quarter of the people who say that they're not happy. Let's figure out why and try and make that better. But I don't feel like this is the spirit of these hearings. We're talking now about lawsuits that are going to go to the Supreme Court. We could, as a Congress, as a committee, address some of these problems and actually suggest changes that we could vote out and then present to the full House of Representatives and make those things better and work. So it's just, you know, our ranking member expressed frustration, and I feel that too. You know, I ran, the reason that I'm in public service is because my hope was that at the end of my career, I could say that I helped provide health care to all Americans. What could be more basic than wanting to do that? Is that really what my colleagues across the aisle are looking for, or is it to nitpick and ultimately sue? I mean, I think about this lawsuit that is being considered today. We're talking about the president being sued for not enforcing the Affordable Care Act, that hated law by the Republicans, for not enforcing it fully. And for not enforcing, they're saying, a provision that perhaps was the most hated, the employer mandate. So I'm just really, really confused. I'm sorry. I appreciate the witnesses. I appreciate that you're looking into these problems and trying to help us solve them. That ought to be the goal of all of us here, and I yield back.
Chair,